It's down to like 6 point something, 6.8. Wow, we didn't. I don't even think we did anything. I thought it was going to be hard. Like we're going to have to do all this stuff, and I mean, I just kept doing what I was doing. I washed my hands 832 times last week, though, so I think that in some ways I contributed to the car score going down.
Well, the car score went up because of the big clusters that we saw at the congregate settings about 2 weeks ago. And it's gone down because the community's doing what they need to be doing. And we were just talking about this yesterday about how we haven't seen a lot of influenza yet.
Right.
We did see a couple of cases that were COVID deaths that also had influenza, but we think it's because people are wearing masks and people are washing their hands. And I know everybody talks about the dengue outbreak last year in the fall, but earlier in the year, from January to around August 2019, we also had a shigellosis outbreak. And people are washing their hands. So we just haven't seen those kinds of cases either because people are washing their hands. People are practicing good hygiene. We hope that continues because we're not out of the woods yet. And we have greater testing capability. They're going to start doing more community testing with the new Binax Now test, which is a really great test. I did it myself. You just basically swab yourself in both nostrils. You don't need a nurse or a medical professional to jab that thing up your nose. Wow. And they stick it in a little card and it gets results in 15 minutes. It's like one of those home pregnancy tests where you see the line if it's positive.
Right.
So they're going to be rolling that out. I believe they're going to be doing a lot more community testing. We were rolling that out to the clinics, and this will help. Because the mask, that's the key, right? The increased testing ability and people still following the rules. And right. Of course, we don't know what's going to happen. I don't know. I didn't go out and about yesterday to see what was going on, but hopefully I did. It looked like it was a kind of low key Thanksgiving. People weren't having mass gatherings. So that's good.
Is the Binax test is this the one that's for for symptomatic people?
It's supposed to be for symptomatic people, but they are talking about using it for more kinds of mass testing. It's really good for congregate settings. It'd be really good once the schools open up and the school nurses could use it, to test kids who are symptomatic. But I'm not in charge of who makes decides on what they're going to do about the testing. And I believe they've been talking with the Surgeon General, the current Surgeon General, to include it as a easy mass testing kind of device. Yes, but it's supposed to be used for symptomatic people.
But it can, I guess, be used if you are.
Well, it tests for the presence of the protein, the antigen of the virus. So I guess it might be. It really depends on how many resources we have.
Mm. Doc,
so they seem to have a lot of tests, and they're rolling that out to the clinics and also for community testing. So
how would that work, Doc, with the community testing? If it's like a self swab, they just like pass out the test.
It basically is. You can swab yourself, and then it's a little card, and they put the solution in there, and then it looks like one of those. It's like a little card. It's much easier than the PCR, but you still have to do the PCR for
backup.
Molecular testing. Right. So it's good that we have more testing capability to isolate people who might be asymptomatic and still have, they test positive, and maybe that's a good thing. We'll see. I don't know. We have 30,000 tests for the Binax. I hope we're getting more. We're supposed to get more as well. And I don't know that they're using this widely in the U.S. Might be just certain jurisdictions got it. I really don't know. You have to talk to someone else about that.
Right. Doc, so when you talk about the car score being down, and so we had 43 positives out of 237 reported yesterday. hospitalizations.
Good. That's good.
Right.
Yes, we're going down, but we're still compared badly to places like Hawaii. For our small population, it's still too high. And of course, we just had the 111th death. And there's always a lag time between infections and when people end up in the hospital and or die. So we're not out of the woods yet, but
Right.
the end is probably in sight, because we also have the vaccine coming, and that's going to take several months, but we just have to continue to do what we're doing. And, I don't think mask wearing is going to go away. I think people should probably still wear a mask. You're going through an airport, anywhere, think about 6 months from now.
Yeah.
Next summer, you're going out somewhere to visit someone. I think masks are here to stay. I think like many of the Asian countries, it's just something you should probably do when you're in an airport or in an area where you're, exposed to a lot of people and you don't know what kind of nasty viruses or colds or flu or SARS that they have. So I think it's masks are pretty much here to stay, and hand washing should be here to stay. Come on, people.
Come on, guys. What's the matter with you?
What?
Come on, guy. Wash your hands. I know you're right. It's a no.
I know. It's just so simple.
Yeah.
Hygienic practices, right? Washing your hands.
I'm
all the
with you,
time.
Doc. Though I think I'm gonna keep wearing a mask even after the vaccine comes out, because I like this. It's a good look. There's a lot of mystique. You know what I mean?
Well, nobody likes the masks, but people have gotten used to wearing it. I mean, it's a good idea.
Yeah.
If you're in a crowded place.
I love my mask.
Me too.
Doc,
Do you wash it? You're supposed to wash those cloth masks.
I do, Doc.
Doc,
Yeah,
when
good.
we had you on a couple weeks back, you were talking about the deaths and how there's a possibility that we could end 2020 with COVID being, I think you said, second or third leading cause of death on Guam.
Yes. Yes.
We're still on track for that, or are we?
We're still on track. It's probably going to be number 3. Cancer and heart disease are always, it's heart disease and cancer are the number 1 and number 2. And then it varies based on what's going on the island. But I think it's going to be number 3.
What about the new numbers that we're seeing? Are they more community spread or part of the cluster or clusters or DOC?
I think it's just a community and household spread that we're seeing because of the congregate setting. We kind of dealt with that, and we're probably going to continue to see that until we can test everybody. There was talk a couple weeks ago about the National Guard or FEMA. Let's test everybody on the island. That would be great. Just test everybody all in, at the same time and isolate the people who are positive and move on from there. But I don't think that's going to happen because they're seeing a surge in the U.S. and other places. And they're not going to give us extra tests. I don't know. Maybe they will. And also some of this money is starting to run out. Some of the emergency money from, I believe I don't know if it's FEMA or the National Guard.
Right. Doc, when you, I just kind of want to go back to when you said doing good, trending downward, not out of the woods yet. So
Right.
what are we seeing with these positives and just everything that's going on with the hospitalizations? Are these just, is it kind of tapering off from this huge surge that we had, or are these unrelated kind of new tests, or do we even know?
I don't know the details. You'd have to ask the contact tracing people. There's actually some states that are just moving away from contact tracing. South Dakota just stopped doing it because of their surge. The emphasis this week from the Council of State and Territorial Epidemiologists was to just concentrate on household contacts. You can't contact trace everybody because that's where they're seeing the spread. I don't know if that's going to be the move forward here or not, but at some point it doesn't matter in the States anyway. I don't know about here. We're still doing contact tracing, and I don't know the details of what they're seeing. It's mainly been household spread, household contacts. And so we're waiting to see, is there going to be a Thanksgiving surge? And if we're going to see a Christmas, New Year's surge. We hope we're not. Hopefully people have been low key and, following the rules and trying to contain this thing.
What do you
till we're out of
anticipate,
the woods.
Doc? I mean, I don't want you to play crystal ball here, but we were told that if we get the CAR score down to 5, that social gathering restrictions will be could be eased. So just I really want to ask, because I don't know how much of it is just political whim to save Christmas, but what is a reasonable easing of the social gathering restriction? Because I don't think we're going to go from 5 to like 50 right away, right? So what would be responsible in terms of rewarding the people, like we were told, right? Positive reinforcement to strive for 5 versus...
Well, I don't think it's going to be lifted by Christmas. No, I think people are going to have a low-key Christmas as well. And until we get the vaccine here, and they're going to start with the healthcare workers and then at-risk population, and then they're going to do the general population, everybody. And it's got to be, you have to get to a certain level of vaccination where you have, I forget what the number is, if it's 60 or 80%, but you can't have just 20% of the population vaccinated. You got to get a lot of people vaccinated to develop this, I guess, vaccine herd immunity. And that's going to take time, at least another 3 to 6 months. And then and we have really low vaccination rates compared to the U.S. We're really good about kids getting vaccinated when they enter school, but we lag behind the U.S. even then. So, and the adult population for flu and pneumonia shots is also very low. We're about 43%, and the U.S. is 64%. So we've got to get those numbers up, and we got to and probably have policies developed about, you have to the kids have to have the vaccine before they go into school and that sort of thing. And it might be that they include that in the travel rules and regulations. And then maybe we can become like Hawaii and open up tourism. I was at Tucson last week. I was getting my car service, and I was like, well, I have to drive around. It's not ready. We went down to Tucson, and it's like a ghost town, there wasn't anybody there. So we want to see the tourists come back. We want to see the kids go back to school. So vaccination will be the key. And it's a question of how they're going to roll that out and the logistics of that, and how we're going to encourage people in our population to get vaccinated. It's like,
got to do a jingle, Doc.
To stop this thing and move on and get back to it, because that will be the turning point.
How involved are you in discussions about the vaccine? Because we hear so many different things. I mean, people are saying, I think you might have said it's not going to be here next year maybe, but then we just hear, oh, it's coming for Christmas. There's just so many things, different things you hear. So what is the real story?
I do not know. That's why you should call up Annette Ogden. She has been involved with the planning for the mass vaccination. Because I haven't been at those meetings, so I don't know. But they keep saying soon, and I believe the Pacific is considered a priority area.
Wow. Well, the lieutenant governor was on the show earlier this week, and he talked about how they were working on the vaccination plan. And then, like you said, Dr. Ann, that it is going to start with the frontliners, the healthcare workers, and then they have to turn in this plan to the federal government. And that's something that they're actively working on, as the lieutenant governor mentioned.
Right. And I don't know the details. I do know that they're going to prioritize healthcare workers because they're most at risk, and frontliners, and then elderly populations, just like the flu and pneumonia shots. And if you are elderly, you should get your flu and pneumonia shot now, so you can be ready to get the other vaccinations in, January. And then I believe they have it's called a mass vaccination campaign. And I really think you should get Annette on to talk about that.
Yeah, we're trying to. Is she there? Bring her on. Just call her in.
Yeah, but the lieutenant governor did stress that it doesn't mean that it's going to be a while for the rest of the community to be able to avail themselves of this vaccine.
Right. So again, we're not out of the woods. Mask wearing, washing of hands, social distancing, it's not going to go away in a month. It's going to take months and months, probably 6 months. Remember I said this thing could take years. We're almost into a year.
Right.
So it just takes time, and it is a pandemic. It's not something that is just the flu season or you got a cold. So,
Doc, what do you think though? In looking at the surges that are going on now stateside, do you see any of that surge making its way here?
no. I think part of the problem in the U.S. is the people don't want to wear masks. Some groups of people don't want to wear masks.
The crazy people.
I was just talking to my mother on the phone the other day because
Where's she
it's
at?
Thanksgiving time. No, they do. They don't even go to the store. My mother's elderly, and my stepdad. It's like they get food ordered online, and then somebody brings it to their house. They don't go to church. They don't go anywhere. They're not doing Thanksgiving.
Wow.
They're just trying to wait this out because they know they're at risk.
Where are they at?
For death, for severe outcomes because they're elderly, and my mom has cancer, and she's worried that she gets this thing and she could die.
Yeah.
So, and there's other groups of people who let's just do whatever we want because we have the right not to wear a mask. I think that's part of the problem in the U.S. and part of the problem with the surge.
Where's your mom?
Michigan.
Michigan. Okay. Yeah.
Yep.
Yeah, it's different in different areas. Like my sister's in Florida, and where she's at, I see them post pictures. They're going around with no masks.
Right.
But then my mom was in Kansas, and she went over to visit her brother in Virginia, and they just sent over a picture in the family chat, and my mom's brother and his wife are not wearing masks, but in the picture my mom is. So I think it's because she came from Kansas, and I know they're having some cases there. I'm not even clear which states it's hot in, but it's interesting to me when you see people not wearing a mask. It really sticks out, right?
Right. And earlier in the summer here, or dry season, June, July, we had some issues with the military, but they've really cracked down on their population. So they haven't seen they're really following the rules. And I guess the threat of fines here for Thanksgiving has helped. So we aren't really seeing problems with the military and, people going out and about. They really cracked down on them. It's more of the local community, and could be asymptomatic spread, but that's why we just can't give up what we're trying to do. We need to continue. Just stay with it all and wash your hands, wear your mask, social distance. It's going to be here for a while. We still have to do this. And I know it seems like it's never ending, but it will end soon once we get everybody vaccinated, or a good proportion of our population.
All right, Doc. Gotta love the realness here with Dr. Ann Pobutsky. You know what I mean?
Well, public health isn't easy. It's all about prevention. And that's what all of that is, prevention.
Right.
Washing your hands, practicing social distancing, wearing a mask. It's all part of it.
What's it like with the department, Doc, and just the people you work with? What's the morale like as we hear this phrase thrown around, COVID fatigue?
Well, our problem is we don't really have a central public health anymore. And so we're all dispersed. We just moved again. And this is our, I think, second week here now at the ITC building. People are in different places. And that's been really hard. This has been during a pandemic to have to move, and if we had the fire. And, this is time for thinking about, we really need a good public health facility and a really good public health hospital. And they're gearing up. There's monies for building the regional and Guam public health laboratory and a mobile lab. So there's monies here now for this kind of thing. And hopefully that'll help us in the future if we get these places that are centralized. I don't know if they're going to centralize it, but definitely having a regional public health lab and the mobile lab will help us. So there's monies there. And we hope that people will see buildings going up in key places. I believe they're thinking about the Northern Regional Health Center. There's some land there, and that's where the modular, it's called not a mobile lab, it's called a modular lab, and it will be shared with the Public Health Laboratory and the Division of Environmental Health, the mosquito folks, and they do the environmental stuff for foodborne illnesses and so on. So those are the kinds of things I hope to see in the next couple of years as we move forward. We really do need a public health infrastructure because public health has been underfunded for 40 or more years. I said this before early on. I remember when they used to have community health centers in almost every village.
Right.
You just went to Central when you needed, to go to the pharmacy or whatever. And that's for baby checks. And, if you had an emergency, it was usually right next to the fire station and the EMTs. And a lot of that just went away in the 80s and 90s. It disappeared. The money dried up, and and this is nationally. Public health infrastructure has not been well funded, and it tends to be reactionary rather than proactive and planning for pandemics and so on.
Is the community health center in Arahan still open?
They're talking about opening it up. I believe there were some issues with the air conditioning, but yes, it is functional. They've moved people out, and they're planning to move people in. They're planning to open it up soon, I believe.
Okay, yeah,
because that's a really great building. Yeah, it's a really functional building.
And it's still kind of new.
Yeah, it's pretty new.
It is. I believe
I
there's also
toured
stuff
it.
stored there from the fire. They had to use it as a storage facility. So there's movement there. Yes, it's a beautiful building. And there's like a mini pharmacy and a mini lab there.
It's almost like a mini hospital. Like I've seen it. It's really, really nice. It's kind of sad that it's not being used.
Well, tell the community to push for it. Why isn't the Southern Regional Health Center open? Can we get tested there? And I believe they have been talking about that. I believe there were some infrastructure issues, and it was being used for storage, but they're talking about, opening that up as well.
Yeah, they don't care about the South, Doc. They don't care about the South. That's it. That's all I'm going to say. Until it's election time.
Well, people can drive down there. Yeah, it's a drive, but
people live
even
down
if you're
there.
in Central, you can go down to Arahan and get tested if that's where they're doing community testing.
Right.
It's not that bad of a drive, Mololo and
It's
Arahan.
beautiful.
It's kind of nice.
Yeah.
Is it some place where they can put the lab and put the contact tracers, and instead of renting out like the ITC building?
Well, it's actually good that we have all the contact tracers and case investigators here in this large area. They're all in one place now, so that's going to be easier moving forward. Everybody's in one place, so that's good. And they're actually trying to set up systems, including the monitor app, the I forget what it's called, Sarah Alert. Yeah. And trying to do this stuff more, digitally, electronically. So, and we're setting up so everybody's here in one place, which is actually going to be good to move us through to the end of this pandemic and move forward. And then I think there must be plans moving forward for the modular lab, rolling that out, opening up the Southern Regional Health Center. And they are planning to do community testing again. I don't know how they're doing it. They were talking about North, Central, South, and we'll just see. Just watch for the press releases. I'm not involved in the details.
What about, have you heard anything about another RET deployment? Rapid engagement team?
You mean the rapid engagement team? Yeah. Well, the problem is they were talking last week about how it's really not rapid. It takes time to plan for these things. So they're moving more to a community engagement model, working with the mayors and or communities at risk. And we're trying to get some more data to everybody. I know everybody wants the numbers and all that, but we moved and we've got some new people coming on board, and hopefully we'll have Stephanie's churning out the daily numbers, but we're hoping to get a weekly report out soon with more of the details on the hospitalizations and characteristics and all that. But the numbers are there. We're trying to keep track of it every day, and the hospitalizations, and we work with everybody involved to keep on top of what's going on. So so everybody's in a central place right now. So that's going to be good moving forward until they figure out where to put public health. And you think this would be a great opportunity when there's money. Let's build a better public health facility. And we're going to get the modular lab, and they're talking about the regional, the Guam Public Health Lab that would also be a regional lab to help the jurisdictions and their testing, because we're closer than Hawaii, you know. Could do the testing here, and beefing up the staff, that's ongoing. And it's helping. We're getting more people on board, and that's been helpful, and we're all in one place. So we're better equipped right now if there is a surge. So I don't think there's anything rapid going on. Like, we can't predict where the hot spots are. We just can't.
Yeah. So what leads to, like, okay, with the latest one, right? So they went in to these couple different apartments, and they ended up testing, and it was something like, I want to say 70 positives out of 200 some tests. So I know you said they don't predict where the hotspots are going to be, but in those instances, is it something like they test somebody and then they test a relative or someone else, and they're just like, whoa, this could be something. So the testing's like
You're talking about the recent clusters of the congregate settings?
The Pika.
Well, and that's where the
Pika
testing's going to help, because the Binax test is really good for those congregate settings like DYA, DOC, barracks, schools. So as our testing capacity continues to increase, that will really help us figure that out. Like, where are these hotspots? The problem with that, the barracks and the subcontractors, is a lot of them were asymptomatic.
Wow.
And we can't predict who's asymptomatic. We don't know until you test somebody. So testing is continuing to increase the testing capacity, and that's going to help us get through this as well.
Okay. Oh yeah, hold on, Doc. Jason has a question. Just take it with a grain of salt.
No, not a question, but a comment, and several of them, Doc. Because I know you said, obviously, this year has been unbelievably, stressful for you, and there's been a lot of long days, long nights, and everything like that. And I even think it was almost a year ago when I met you for the very first time, when you were mentioning the dengue outbreak, when we did that press conference at the Northern Public Health Center, and I was live streaming that. That's the first time I met you. But there are several people in our chat room right now that are saying, thank you, Dr. Ann. Every time you come on, we really appreciate the information. You're getting a lot of support from the community right now, and people do genuinely appreciate what you do and the tireless effort that you're putting out. So we just wanted to share that with you. And, people do have your back here, and they really appreciate it.
Well, public health is usually an unseen force, and when it works, you don't hear from us. That means the prevention is working, and you only see us when these bad things occur and these outbreaks, dengue, Shigella, and now COVID. So if prevention is working, then you don't hear from us. That means that's good.
Yeah.
That means people are getting vaccinated, their kids vaccinated, and pregnant women are going to see their doctors and all of that, and older people are managing their chronic diseases, and we kind of stem the infections, and we make sure people are getting treated with sexually transmitted diseases. That's actually the biggest numbers we always see, and people don't realize how common communicable diseases are, because we're always addressing the issues: STDs, Hansen's, tuberculosis. We're always in the background, maternal child health, those kinds of things. And when public health works, you don't hear from us. When things aren't working, that's why we're here to embrace the community and help them help us, because we can't do it alone. We can't. We have to have the community. Public health is community health. Bottom line.
Well, there you go, Doc.
Thanks,
Thank you.
Okay.
Happy Black Friday. Buy us everything.
Happy Thanksgiving, and everybody have a safe holidays. Keep the faith. Keep doing what you're doing.
Thank you, Doc.
Take care.
Okay.
Okay, we'll see you. Dr. Ann Pobutsky, our territorial epidemiologist from the Department of Public Health and Social Services.
Yeah, man, I was thinking about that. I was like, it's almost a year. that we did that dengue press
Yeah,
conference. or
it
something
kind of seems
that.
like it went from dengue to boom, straight to COVID.
Yeah, just the passage of time has been so nuts.
Yeah, it's almost December.
Oh,
Yeah, it
she's
is.
still talking
almost
to you.
December.
Oh, hold on, Doc. Hold on. Go ahead, Doc. Go
Say
ahead.
again, Doc.
Go ahead.
Oh, say again, Doc.
I'm sorry?
Can you say that again? We had you muted, but what were you saying?
Oh, dengue. We haven't seen any dengue cases since March. We've had 4 negatives. People have been tested, but we haven't seen any since March. So it could be that all those public health spraying efforts and cleaning up the trash really helped, because look at how much rain we've had.
Right.
We haven't seen any dengue, and we've seen very few Shigella cases compared to last year.
Let me tell
we
you-
just did our reporting on the annual diseases to the CDC, and we don't see it. And that's because people are wearing masks and washing their hands, but you still have to clean up the trash, and you need to stop mosquitoes breeding in your house.
Yeah, there are definitely mosquitoes out here, though, Doc. Trust me.
That's why public health never ends. It's prevention.
Hey, what are you eating today, Doc?
I'm sorry?
Are you eating leftovers today?
I have some leftover pumpkin pie and turkey.
I'm curious, what'd you cook yesterday?
I cooked a very small turkey and, stuffing, some fruits, vegetables. Nothing big, low key.
Right on.
Same thing for Christmas. We're not doing anything. We're trying to. Next year,
Right, next year.
we'll all be vaccinated.
Right
COVID
on.
will be over, and something else will turn on.
Oh,
I hope
Oh
not.
no! Knock
don't
on
start with
wood.
that.
You never know. That's why we're doing more preparedness and planning for the future.
Thank you, Doc. Bye for real
Okay.
now. Okay.
Adios.
Okay, hasta. We're KUAM FM and Agotnia, Guam. Again, Doc.